again, it all depends on each case. So you can combine it with one of the trends, which is the salmon sperm.
Salmon sperm? What?
Yeah, they're injecting salmon sperm these days.
If you are over the age of 40 and you can honestly tell me that you have never once looked in the mirror and done this, right? You're lying, okay? Because many of us have, even whether we do it for curiosity or just for giggles, or we're seriously considering facial aesthetic procedures, right? So some of the most popular ones are Botox, fillers, microneedling. You might have heard of these. However, what are the pros and cons of these? And how do we strike that fine line between looking like we've had a lift and a refresh and looking like we've had work done? Well, a woman that knows her stuff when it comes to facial aesthetics is Dr. Wafaa El Mouhebb. She is a medical doctor, she's a mum of 3, and she is the founder of the Dr. Wafaa Clinic in Berkshire. Thank you for joining me.
Thank you, Rena. Thank you for having me today.
So we've got loads to talk about. And I want to just reiterate, you are a medical doctor.
Yes.
And I'm saying that again because in this industry of facial aesthetics, there are a lot of people who are offering these treatments who are not doctors, right? It's quite a unregulated industry, am I right?
In the UK, yes. Abroad, no. In other countries, you will find it should be done by doctors or plastic surgeons or qualified doctors. In the UK, unfortunately, you see everyone is doing it, yes. So, yes, my background, I am a medical doctor. I graduated from medical school in 2007, and then I did my specialty in internal medicine. Then I moved to Saudi Arabia, where I started to work in dermatology. And at that time, I was suffering of some acne. Not some acne, a lot of acne. And, I had my wedding, I had my kids and everything. And when I was looking in the mirror, I was feeling this confidence that was striking me. And I always wanted to help women in feeling more confident. So I wanted to do a specialty where you can help women feel confident in their skin, happy with how they look, improving how they look without looking fake. And I didn't want to go via the surgery route. Plastic surgery is a bit too long, especially when you have kids and you are married and all these things. So I found out that aesthetic medicine is one of the main branches that I would like to go through. And this is where I moved to France and I did my qualification. I did a master in aesthetic medicine. And I found myself in the UK later on, having my own clinic.
Okay, so you've been in this industry for a while.
13 years, yes.
Okay.
Yes.
What are some of the things to look out for, because you've mentioned that in the UK, the industry is quite unregulated and things like Botox and fillers are quite popular now. So where are people kind of going wrong with these things, do you think?
Unfortunately, what I've noticed here in the UK is that people think, not only in the UK, anywhere, people think that Botox and fillers are just needles you stick in the face and that's it, you get the result that you want. However, they forget that we are humans and we have muscles, we have skin, we have our expressions and all these things. So if you don't know the anatomy, if you don't know how your face is moving, if you don't know what are the implications of every treatment, what will happen, what the material that you are using, what it can have as an impact on your health, then this is where you will start to have complications, or this is where also you will start to have results that are abnormal. So personally, I feel like medical practitioners especially, I don't want to go through, it should be a medical doctor, but at least someone who has a medical background, who understand the anatomy, the physiology of the face, they understand what they are using, how the needles, the product they have in the needles, how to treat complications, which is very important. This is what you should look for when you are looking for an aesthetic practitioner. And you need to look at where they have been trained, how many days did they have? Because here you can do 1-day course and just go and stick a needle in the face of someone. No, you need someone who is trained and has experience before giving them your face.
What kind of treatments do you offer at your clinic?
So I offer all kinds of treatment, cosmetic dermatology, treat acne, pigmentation, hyperpigmentation, melasma, aging, all these things. In addition to, Botox, fillers, microneedling, anything that target the skin and anything that enhance the facial features.
So I feel like at this time, and maybe it's always been like this, there is a real emphasis on anti-aging. I'm not really a fan of that word because, like, we're aging. What are you going to do about it, right? However, our skin, there's no denying, it changes, right?
Yes.
What is going on in our faces as we age, and how could we kind of, I mean, what can we do about it?
Yes. So if you want to talk about, first of all, aesthetic medicine was always known before as anti-aging medicine.
Was it? Yeah.
Then it has been changed to aesthetic medicine. Anti-aging medicine is just to do procedure that will help you stay like the way you are, or maybe age a tiny bit, but age gracefully. Okay. Then people have started to add treatments like big fillers, big lips, big cheeks, and things like that. We will come to this later on. However, when you look as an anti-aging medicine, and we want to talk about how the skin age, our skin is affected by different things. It's affected by the environment. It's affected by our hormones. It's affected by the lifestyle. If we look at the environment, we have the sun. We have the pollutions. We have how we are protecting our skin, what we are putting on our skin that is protecting us. Then comes the hormones. So us as women, our skin is a lot under the influence of two main hormones, which is the estradiol and the progesterone. When we cross the age of 40, the estradiol, which is our hormone, start to decline. And as it declines, what will happen? The main function of the skin start also to decline. So it will affect the superficial layer of the skin. It will affect the deepest layer of the skin, which provide this elasticity and this bouncy effect that you have. So you start to lose, and you feel like everything is going down, everything is sagging. I'm starting to have wrinkles.
It's going to make me cry, Wafaa, here.
It's happening to me too.
Something, honestly, like since that, like mid-40s, something happened to me. I feel like all the collagen in my face just went, I'm leaving and I'm done. Bye.
Exactly.
Checked out.
Exactly. The collagen starts by the age of 40 to decline 10 to 15% per year. And once we reach the menopause, it's like a cascade. And you just feel like, what happened? Yeah. So it's very important. It's very important to focus on collagen health. Very, very important.
Is that the bouncy layer that you're talking about?
Yes.
The collagen?
Yes.
Okay.
Yes. So the collagen is the framework of a lot of tissues in our body. So whether it is the bone, whether it is the cartilage, whether it is even in the eyes, in our skin, it provides this elasticity. So this protection, the bounciness that you have in the skin. The collagen and elastin are the most important things in the skin. Yeah.
So you said for women, because of our hormones, this is what happens. Doesn't it happen for men as well? Because men, what is it? Is it less for them? I'm going to get really annoyed here now if you're going to say that. Yeah.
It is the same. Also, they are affected, but they are affected also a lot by their hormones, yes, and also by their environment, their work. They work more outside in the sun. There's more sun exposure. They don't care about their skin. They don't care about any skincare. They don't get bothered by applying any skin treatment to their face. So for them,
I mean, I think things might be changing. Maybe they do a little bit now, but I do know some men who just literally like apply body cream and they keep going to the face, and then they're like, yeah, bye, I'm out the door, right?
But same body cream, same body
Yeah. Same body cream, just keep going to the face, to the head, I'm out the door. I mean, I used to do that when I was a kid. I miss those days. I really miss those days because it was simple, and now we've got to think about collagen leaving the body, like gravity. Gravity is my biggest op right now. I literally hate gravity. Okay, so what can we do though in order to kind of maintain the collagen? Do drinks help though? Because there's a big thing now about like, drink collagen. There's so many brands offering collagen drinks or tablets.
Drink help? So I get a lot of this question. Now, let me tell you, collagen, first of all, is a protein. Okay, protein are digested in our stomach. If I talk scientifically as a doctor, if I take a drink that is saying collagen drink, I will get it digested in my stomach. Okay, I will get the end result, which is the amino acids. The amino acids are fine. Yes, I need the building block of the collagen of my skin. I need these amino acids. So, okay, that's fine. If someone tells me I'm giving you a supply of amino acids, I would be happy. But someone who's telling me I'm giving you a supply of collagen to drink, I would think a little bit about it, because saying collagen by itself, collagen is a protein that will be digested. It will not reach the skin. It will be formed under the skin. However, all the studies that have been done in the industry are all paid by companies that create these collagen. So that's why they are showing it's giving us results. While for me, I'll be very honest with you, if you rely on a good chicken broth and you take vitamin C in the form of a diet that is rich in citrusy food and vegetables, for example, this is already providing your skin with the building block that it needs to form the collagen. Because your collagen needs two things to be formed. It needs, first of all, the building block, which are the amino acids that you get from protein, or like I said, the chicken broth, for example. And you need the vitamin C, which is help the enzyme in the formation of the collagen molecule. So when you give this and you give that and you stimulate the cell that form the collagen, that's it. No need to drink these collagen drinks and all these things.
Okay, so good old chicken broth and oranges and stuff.
Unless you tell me, my diet is completely reliant on I don't have protein in my diet. Then I will tell you, okay, you can have this collagen drink, but you need to understand that it is not, you're not drinking it and it's going directly onto your skin. It will be digested. It will provide the amino acid. The amino acids will be used by the fibroblast in your skin to form the collagen.
Okay. So let's talk about these trends that are out there right now. Like you said, there's a certain type of face which is very much in vogue right now. The cheekbones, the small nose, the big lips. How many people come to you wanting those kind of things?
I have a lot, especially these young girls who are looking at TikTok and seeing these big lips, these big cheeks and all these things. The issue is that I believe, I don't know, maybe other colleagues would disagree with me, but I believe that every woman has her own beauty. Yes, sometimes I might need to do some tweakments just to enhance the attractiveness. Like sometimes you might have a nose that needs just a tiny bit of filler to improve how it is lifted and slim, for example. Or a chin that is going backwards, so I just need to bring it a tiny bit forward to balance the face. We need to understand that aesthetic is all about balance, okay? You can use filler to enhance a feature as long as you are respecting the balance of the face. So if I have a face that is a person who's coming with a small face, small eyes, small nose, very fine features, she cannot expect to have a gorgeous result or something that is attractive by asking me to have a big lips, for example. There will be an imbalance here. There will be something that is not, yes, lips, those that are plumpy, it's attractive, I know, but there is a certain amount where you cannot cross it, and you need to look, does this feature suit her or not?
I mean, I think a lot of people have crossed that limit at this moment in time, right?
Yes, exactly.
Do you turn people away sometimes?
A lot.
Really?
A lot. Unfortunately, they get mad at me. But yes, I have a lot of patients who comes to me and they want lip filler, and just tell her, for example, no, you're not a candidate for lip filler. Or can I have a little bit more of cheek filler? And she already has good cheeks. Or for example, if I add cheeks, this will create an imbalance. I will tell her, no, there is a limit. There is a limit. Aesthetic medicine is about beautifying, about enhancing, and not making you look like the neighbor next door or like someone else.
Okay. So you mentioned filler there, and that is something that is quite popular at the moment. What are the pros and cons of having filler, and when would you advise somebody to get filler?
Look, it really depends on different things. So first of all, filler for enhancing or improving a features can be used in certain areas. Like for example, I have a chin that is coming back. I want to bring it forward just to bring this balance or enhance the jawline. That is a good treatment. Nose, I want to enhance the nose. I want to lift the nose. I want to treat a bump. It's a very good treatment. Non-surgical rhinoplasty is an amazing treatment, is an amazing alternative to surgery. I have a patient who have lips that are incompetent. They are not closing well. When they smile, they are showing their gum and things like that. I can help with filler, yes. So this is when I use the filler to change a feature, to improve the feature while respecting the balance of the face, to create something that will make the lady or even the man feel better in themselves. But I personally believe that filler also has another use, which is anti-aging. And here you will tell me how anti-aging, how filler can be anti-aging. So as we grow older, it's not just the skin that is losing collagen, by the way. It's also the muscle because of the gravity that start to get saggy, and underneath the muscle, you have the fat, which create the contour of your face.
Right.
So you start to lose this fat. And as you lose this fat, the support of your skin is lost. So you feel that everything is going down. When you replace this volume loss with filler, and the right filler, this is where you are creating an anti-aging protocol. And this is where you are getting something, you are like turning the clock 10 years back.
Okay, so for example, the structure of the face you're talking about. So you'd put filler here. You put filler here or here?
It depends. You need to assess. And always we start from up, we go down, because usually we lose up, so from the temples, and then we go down. It needs to be assessed. Each case is different. It's not like a rule. This patient, I will do for her cheek, no nasolabial folds, chin. No, each case differ. You know, if you take a face and you look how it age, it's age. One side will look more flatter than the other side, for example.
Right.
It's because they sleep on one side.
Yeah.
So you have the effect of the sleeping. They masticate. They use one side more than the other side. So you have a muscle that is stronger. So any treatment is personalized. You need to sit, the practitioner need to sit to look at the patient, assess their face at rest, while moving, knowing what they want, what they are looking for. There's a patient who comes and they tell me, I don't want to look 10 years older. I just want to look fresher. And then filler is not the choice for them. Then you just need to target the skin. Just by refreshing the skin by itself, they're already happy. So we need to respect not only the anatomy and physiology, not only what product we are using, but we need to also respect what the patient wants.
So if a patient is saying, you know, I want to lift my face a little bit, and you've assessed them, you'll put filler here, right? I mean, or if they're not going to you, for example, people are getting filler put here and they like this uplift. What are the things that they need to look out for, though? Because how long does it last, and how many times do you have to top that up? Like, after how long?
So filler, first of all, doesn't lift. Filler, it replaces volume loss.
Right.
People think that it has lifted just because the skin has gone down, deflated, and they just added filler, so it has just restored the volume that they have lost.
Right.
People think, I'm doing a facial lift with filler. Filler is not glue. It will not lift. It will not take up the face. It will just replace the volume that we have lost. Now, there is some people who just come and they said, I just want cheek filler.
Right.
That's it. But if you look at them, you find out, for example, that they have a lot of volume loss in the temple, or even a volume loss in the forehead. If you fill the cheeks and they look like they have gained weight and they look healthy and they look fine, but you look at the whole face and you see that the upper face, there is, in fact, skeletization, there is loss of volume, there will be a discrepancy. And this is the art in aesthetic. You need to create a balance in all the face, not just one area. You need to assess the whole face. And you need to understand that, for example, when I'm treating the upper face and I'm treating the mid-face, they are connected to each other. So I need to treat and replace the volume in the upper face and then treat the mid face. But again, it's all about assessing the patient, knowing what they want, and then educating the patient why you are doing that and what is the goal of that, and why, for example, you don't want to do that, and what is the result that you are looking for. Okay. Once you do that, and you choose the right filler, and you use the right technique, believe me, filler can be magical. And just, you will still look like yourself. People are always scared that, I will look different to myself.
Well, I mean, there's a lot of people out there, right? A lot of celebrities as well, who apparently haven't had anything done, but then they've got a very puffy face, like here, where they never had cheekbones before. It's very prominent, right?
Exactly.
That's filler.
Yeah.
Is that filler?
Filler, yes. Sometimes it's fat graft. It depends on the procedure that they have that done, yes. But yes, there is cases where it's too much overfilled and you feel like, no, too much. They cross the border a tiny bit. Not a tiny bit, too much.
What is filler? What is actually in it? What are people getting put in their faces?
So it's formed of molecules. You have different type of filler. Are we talking on the general?
Generally. The one that's most commonly used to put in the face?
The most commonly used that we're using now in the UK market is the filler that is formed of hyaluronic acid. So hyaluronic acid is a molecule that we already find in our skin, in the middle layer of the skin. This layer usually it provides the support of the skin and it absorbs water and give the hydration in the skin. Okay.
Right.
Now for the filler, how did they form it? They took this high molecular weight hyaluronic acid and they cross-linked it. So they took many molecules and they linked it together. The more you link it, the more it creates volume. So for example, you use it for the cheek for more volume, for the nose to create like a bone shape. The less it is cross-linked, the less it creates volume and it's more supple and it can create hydration. So for example, we use it for the lips or for the skin. If we have dehydrated skin and we want to hydrate it, we use a non-cross-linked hyaluronic acid filler or skin booster, we call it, just to hydrate the skin. The hyaluronic acid, it absorbs its weight 1,000 times in water. So once it's injected, it's not only the gel that you are injecting, it will also absorb water and it create more volume.
So when you inject, the area gets bigger then when you put it in, right?
Yes.
Okay.
And you can expect the next few days also it get bigger and bigger.
Okay. All right. I mean, it sounds kind of scary, but evidently you guys, you know what you're doing. So fine. Okay. What about Botox? Because Botox is something which I think is very common now. Like people are not even ashamed to say like, oh, I'm having Botox and whatever. Is it normally used in the forehead?
Can be used all the face, it can be used in the neck, it can be used in different areas. So let me tell you how Botox works. Botox is botulinum toxin. It's secreted from a bacteria called Clostridium botulinum. So it works by stopping the movement of a muscle. So for a muscle, let's imagine my hands, this is the muscle, and you have a nerve. For the muscle to contract, it needs to get the order from the nerve. Okay? Now, the Botox comes and cleaves the area of junction between the nerve and the muscle. So even if the nerve is giving an order to the muscle to move, it will not move. And this usually stays for 8 to 12 weeks. After that, your body will regenerate itself and it will heal. So there will be movement. Now, Botox target the muscle. So when you are targeting the muscle, the skin over it will be relaxed because it will not move. So if it doesn't move, you will not have these wrinkles, the dynamic wrinkles that happen when you are moving. Okay. At the same time, when you are stopping these dynamic wrinkles, if your skin is dry, you are stopping the dermal fracture, which is the fracture into the skin. So you don't have these fixed wrinkles happening, or you are delaying it from happening. Another thing is that with Botox, we can create a lift. So you have the muscle of the face, they are all interlaced together. Okay?
Right.
If I stop one muscle, like this one, from working, and I keep this muscle from working, what will happen? It will pull this muscle, this side. So, for example, in the eyebrow, if I stop the muscle around the eyes from working, and I keep the muscle above it working, it will create an eyebrow lift.
Wow, okay.
Same thing in the neck. In the neck, we have a very strong muscle called the platysma, which comes from here and goes down to the clavicles here. It gives us these text lines that we have when it contracts. And it gives us a bit of jowl if we have it very strong. If I stop it from contracting, I can improve the jowl.
I mean, this is such an education because I think me and a lot of other people think you just go into anywhere that offers you this and they go, how much do you want, babe? And then stick it in your face and then you just walk out the door.
Exactly.
Not all of this. Like,
exactly.
This is is an education. Definitely.
And not only that, it's very important to educate about something. For me, personally, I consider Botox is just a temporary fix. So I can stop your skin from moving. I can improve the appearance of the wrinkles, but if I don't work on your skin and I stimulate it and I hydrate it from inside, while your skin is at rest, it's still aging. So the moment the Botox will completely go, the effect will go, you will feel your skin is aging more. It's because you were not treating your skin. You just stopped the movement, but you didn't treat the skin. So it's very important to treat the skin during this time. While you're treating your skin, you are enhancing your skin, you're stimulating your skin. Once the Botox is gone, you will feel like, oh, wow, I'm still looking fresh.
So how do we do that then? Treat the skin, enhance the skin?
So many things. We can start by holistically up to treatments, in clinic treatments. So holistically, you need to Avoid stress, which is not very...
Oh,
Yeah.
okay. Right. Don't know about that. Yeah.
Have a healthy diet, exercising, and all these things, just to reduce the oxidation that happen in the skin and all these things. The most important things: protect ourselves from the sun. And no, it's not the sun that is giving us this warm effect, like I'm feeling warm. No, it's even like now, despite that it's cloudy outside, you have UVA rays that is
Right.
coming inside the room, which is creating damage
Okay.
to the collagen. So UVA rays, we need to target the superficial layer of the skin by stimulating it. So as we age, the skin, which usually renew itself every 28 days, start to renew itself every 30, 35 days, 40. So what will happen? There will be accumulation of dead skin over each other. So your
Right.
skin become thicker and drier. So you need to stimulate your skin in such case. And it will be by use of treatments. It depends on what after your consultation with your doctors, but that will exfoliate and stimulate your skin cell turnover.
So are you talking about things like microneedling?
Microneedling will be something that goes toward clinic treatment. So these are treatments that you can do at home. And then in clinic treatment, we are not working on the superficial layer. We are working on the superficial layer and the deeper layer, which is the dermis. So we stimulate the fibroblast, which is the cell that will form the collagen. So it will take your amino acids and you take the vitamin C, and it will form the collagen, which will create this bounciness into your skin. Also, microneedling work on the superficial layer on the skin by improving the communication between two adjacent cells. So when the communication is disrupted, you start to have hyperpigmentation, you
Right.
start to have tags and things like that. When you re-regulate it with microneedling, you are improving your texture, you're improving your tone, the pores, and all these things. So yes, one of the things will be the treatment in clinic, like microneedling, medical microneedling.
As opposed to what other microneedling?
So there's people who do, I'm doing the microneedling at home, which is just 0.3 millimeter, and they use this stamp or things like that at home. This is a cosmetic microneedling. The medical microneedling is any microneedling that cross 0.75 millimeter and go deeper to reach the dermis to stimulate your skin.
Okay, so this is a series of you're passing like needles over the
Yes,
face,
yes.
and then are you doing some kind of light treatment at like what do you do?
Again, it all depends on each case. So you can do microneedling, you can combine it with the skin boosters, you can combine it with one of the trends, which is the salmon sperm, the polynucleotide. You can combine...
Salmon sperm? What?
Yeah, they're injecting salmon sperm these days.
Who even thought of that, to do that? That's what I don't... Like, who, why? Okay, does it work?
Yes, it works. So they have found that...
What?
Yeah.
Who
It's helping
thinks
rejuvenation.
of this? Okay.
I don't know.
Anyway, it works, right? So
It's helping rejuvenation. Yeah, it helps in rejuvenation in the skin. It helps in stimulating the fibroblasts. It provides the hyaluronic acid and all the boosting of the skin.
Right.
So when you combine it, with microneedling, it's an amazing treatment. We are seeing amazing results in the clinic, especially around the eyes.
Okay, I mean, I don't know how I feel about that, but clearly it's working for some
Well,
people.
just like when you hear about exosomes, for example. Exosomes, you have different type of exosomes. You have, which are vesicles that will stimulate your skin, but they come either from plants or there is some companies, they get it from another human. So, yes.
Oh my God. Okay. I mean, right. Part of me just wants to check out all of this and say, leave me alone. I'm going to do what my husband does and use the same cream. And just keep going and be like, no, thank you. Let me look old, right? But like you said, it is about confidence and
Exactly.
look good, feel good, and vice versa, right?
Exactly.
Right. So, Wafaa, you're obviously a doctor, and this is what you offer, and you've gone really deep into what happens, which is amazing. But do you think that there has to be like a balance for our own kind of mental and physical health of accepting you're going to look a little bit older, and then rejuvenation and trying to hang on to collagen and things like that?
So you're asking a difficult question, because as a woman myself, when I look in the mirror and I feel that I'm aging, it's in our gene. It's in how we are created. We don't like to look like, we are aging, we are losing the plot and everything. We just want to stay young, attractive and everything. I don't find there is anything wrong in doing things that will keep you look. I don't say younger, but still look graceful in your age, and you look not like you have a lot of wrinkles and you're old and all these things. There's nothing wrong in that. For me, it starts to get wrong when I want to look like someone specific, or I want something specific to change in my face. And whatever I'm changing, I want more and more and more, because I see myself like I'm not worth it. And this is something that needs to be targeted, especially during consultations. So we have you have patients who have body dysmorphia, for example.
Yeah.
And these cases, they need to be, you need to consult them very sensibly, because even whatever you will do for them, they will not be happy. And it's more about something in their confidence. So you need to work on their confidence. You need to explain to them that we are all created, and we all have our uniqueness. We all have something beautiful in us. We just need to know how to enhance it, but not to look like someone else. Like, you cannot. I still remember when the big lips started, the trend of big lips. I had patients who came with a photo of Angelina Jolie.
Really?
And telling me, I want the lips of Angelina Jolie. And I was like, okay, Angelina Jolie, she has big eyes. She has big facial features. She needs big lips. No way she does. With a smaller lips, she will look like weird. When I have someone who is coming and she's soft, very soft feature, petite and all these things, and she wants these lips, there's something not working here. We need to discuss. You are soft, you are gorgeous, you are beautiful. I can plump your lips, yes, tiny bit, just because you are losing hyaluronic acid anyway in the lips also when you are aging. So just to define it more, but not to the point to make it big to look like someone else. So here comes the role of the practitioner. Here comes the role of the one who is injecting. They need to be ethical, to know when to say no. Even if you will not be happy. I'm sorry for that. I'm explaining to you. I'm giving you all the alternative. I'm telling you why this doesn't suit you.
Yeah.
You're not happy. I cannot do more than that. I will try as much as I can to make you happy, but I cannot put myself in a situation to inject you just so you feel happy, but by creating harm to you and letting other people look at you like, what have she done to her face?
Yeah.
So this is why it's very important when you're choosing your practitioner.
Yeah,
this comes to the first question you have asked me.
Yeah. And, like you said, it's the whole thing about aging and whatever. It's, even though sometimes we think, oh yeah, this happens, it's not easy, Even I find, like, when I'm doing my makeup, like, because I've been wearing eyeliner since I was like 20 years old and stuff, and now I feel like if I blink when my eyeliner's not dry, it will like transfer to the top lid. I'm like, what is happening to my eyelids? Yeah. And I'm like, oh, I don't know how I feel about that. But yeah, so okay.
But for us, it's normal. We are aging. It's normal. It's in our nature. What is scaring me these days is the teenagers that you are seeing in schools, and they are starting to say, I am having wrinkles when I'm smiling. I need a bit of filler to improve. I need to do this. Eyelashes, for example, like abroad from aesthetic, you have these girls who are putting these eyelashes, a lot of eyelashes, while they are, I don't know, I believe they are at a stage where there is this innocence in their face and all these things. Why to ruin it from this stage with these
and they're still
trends?
Growing,
and they are still growing.
That's what I said to my kids as well. I'm like, you're literally still growing.
Exactly.
Don't worry about me. I'm grown. I'm on the decline. Let me do what I need to do. Yeah, exactly. But yeah, absolutely. So in terms of like refreshing, trying to look natural but rejuvenated and not look tired, because I think that is one of the things, isn't it? Like, nobody wants to look like, oh yeah, I'm done with life, or like I've had a hard life. You know what I mean?
Yeah.
What are the best things for that? And I know you mentioned a range of things, but what kind of things would you recommend for just looking fresh and revitalized, however old you are?
If you want to prioritize something, it will be your skin health.
Okay.
Take it that way. You have a gift, and you have the wrap, and the wrap is cringy and all the things, but the gift is an Apple Watch, for example, okay? How the gift will look if the wrap is not well tidy up. To look like, what is this gift? It's something cheap, right? While even if you put, I don't know, you put a candy, but in a wrap that is very well knitted and very elegant, how it will look that it is so much, it's classy and all these things. So it's all about the outer layer, which is your skin in your face. If you have a healthy skin, you have a skin that is glowy, you have a skin without any problem, like you have treated, you controlled your pigmentation, all these things, you have a skin that have a good tone, good texture, this is by itself, it makes you feel refreshed. And then we focus on other things, like if you need filler or you need a bit of Botox. But your skin, it is the base of any treatment. Because even as I told you, Botox with a skin that is unhealthy, I don't know, it's like you are turning a wheel and putting bars in it.
So you would rather, like you would first of all recommend treatments to stimulate collagen, stimulate the skin, and then talk about Botox with people and fillers.
This is a priority for me.
Okay.
This is a priority. Skin health, skin health, skin health, skin stimulation, and then we go Botox or filler. And usually we start the epidermis, which is the superficial layer, with a good skincare, and then the dermis, which is with microneedling, with a treatment biostimulator, whether it's salmon sperm or skin booster. It all depends on the case. But yes, once I have achieved a healthy skin, even the skin that is hydrated, plumpy and everything, the filler, if I add filler, it will look better.
Okay. That makes sense. So we could be here all day talking about all these kind of things, and your knowledge is like insane about all of this, and I love to kind of learn about this. But if people want some more advice from you, if people want details of your clinic and the procedures that you offer, where's the best place to find you? Do you have a website?
So there's the website, yes, www.drwafaaclinic.com. There's also my Instagram. There's also my Facebook, so I always post things there. And they can contact me there. Just book a consultation or even send us a message. Send me an email and I can advise them what would be the best for them.
Thank you so much, Dr. Wafaa. It's been a fascinating discussion.
It was a pleasure.
And I feel like I've learned a lot. Great. Thank you so much.
Good.
And thank you for watching. Obviously, you know how to get in touch with Dr. Wafaa if you have any questions or want to find out more. Catch you again next time.